Today is exactly a week since I've had my bilateral jaw joint replacement. I've had small improvements every day, but the small improvements are kind of a big deal, such as I can actually close my mouth without too much struggle today. That's before today I had to really push myself to be able to close my mouth. I still have the paralysis. It doesn't seem to be as bad, but it's still there. I was able to eat eggs today. I've been living off of cheese grits and mashed potatoes and smoothies for the most part. So it was nice having some scrambled eggs with cheese. And I would imagine each day, now that I can start chewing soft foods, each day I'll be able to chew more and more. One of the things that I'd suggest is to keep a journal of your medications. Every day I write down the time of day and what I'm taking, because it's easy to forget with all the medications. I mean, I include my vitamins. When did I take my vitamins? You know, and you take your steroids and you start off taking them several times a day, and you wean off of that. And then you have your pain meds, and then you have your antibiotics, and then, you know, that's for the most part. It's a really good idea to have a journal to write down when you took your meds, because when you don't, especially with the pain medicine, and you're kind of loopy to begin with, you can easily lose track of whether or not you actually took the medicine or did you just think about taking it. It's also a good idea to look up your pain med to know the half-life, when it peaks, and the half-life. So for me, I'm taking a hydrocodone. It's like a generic form of Vicodin. And I looked up the half-life to see, because it says the directions are, I believe, every 4 hours. And it helps me to understand and to plan my or handle my pain management, because the half-life is approximately 3.8 hours in your system, and it peaks at I think 1.3 or 1.5 hours. So when you are in pain and you take your medicine, you can look at the time and you can see that you're feeling better, and you know why, and that you're peaking, and that time's coming up and you're going to start feeling pain again. So I found that to be really helpful to know that about your pain medicine. Also, I've started weaning myself off of the pain medicine. I started to see how far I could go, or how long I could go without the pain medicine. It's not fun when you do that, but you can't really gauge how well you're getting without finding out how long you can go without pain medicine. You know, just as long as you can take that pain medicine. So if you can wait an extra hour to take your pain medicine, that's a good idea. And then I think it also helps you strengthen yourself, because if you're taking the pain medicine and you're not really pushing yourself, you don't know your limits. And then I've also started breaking my pain pills in half, so I'm not taking full pills, and that's a good way to wean yourself off of the pain medicine, because I mean, you're taking pain medicine around the clock and it is addictive. It's also difficult when you have children and you're a little loopy and you want to get back to having a normal life. The other thing that I've been using, especially at night, is a Biotene oral rinse, because I haven't been able to shut my mouth, especially during when I'm sleeping. My mouth gets so dry. So that is really helpful. And they have a spray and they have a rinse. I couldn't find the spray. I was really hoping. I went to 3 different stores and I just got the rinse, and that's better than nothing. So I do highly recommend getting a moisturizing mouth rinse. Tomorrow I go for my first follow-up. So you can see the progress of my incision and bruising. I'm not happy about the stitching on this side. I don't know what happened. I don't know if you can get a good look with it, but it's rather tight and it's raised. I don't know. I'm really wondering if the surgeon actually stitched this side or if he had a med student stitch it up or something. I don't know. But I'm slightly concerned about the scarring, but not too much, because I mean, I'd rather have a scar than have busted up jaw joints and pain from that. But overall, I feel pretty good. I was very active this morning. I got up. I rode with my son to school and went to the store, sat outside in the backyard and got some fresh air and sunshine. I plan on, I got tired, so I rested for a little bit, and I plan on getting up and going for a walk. I think being physically active is really important. You get the blood circulation going, it helps get the toxins out of your system, and it helps, for the blood flow to bring nutrients to the healing sites and to heal quicker. So this is the 1 week post-op. If anything comes up tomorrow, as far as my improvement with my mouth, my bruising and incision, or if anything that the doctor says, I will definitely post that.